Question 1. The RN is receiving shift report on 4 clients. Which client should the nurse assess first? A. Client with COPD requesting inhaler refill. B. Client with new confusion after surgery. C. Client awaiting routine discharge teaching. D. Client scheduled for physical therapy. Answer. B. Client with new confusion after surgery. Rationale. New confusion may indicate hypoxia, stroke, or sepsis, and represents an acute change in condition requiring immediate assessment. The other clients have stable or routine needs. Question 2. Which task is most appropriate for the RN to delegate to the unlicensed assistive personnel, UAP? A. Teaching wound care to family. B. Assessing lung sounds. C. Measuring intake and output. D. Evaluating pain control. Answer. C. Measuring intake and output. Rationale. UAP may perform data collection on stable clients. Teaching, assessment, and evaluation require professional nursing judgment and cannot be delegated. Question 3. The nurse notes a coworker documenting care that was not performed. What is the nurse's priority action? A. Ignore to avoid conflict. B. Report according to policy. C. Confront in front of staff. D. Document in the client chart. Answer. B. Report according to policy. Rationale. Falsification of records threatens client safety and must be reported through proper channels. Ignoring or public confrontation is unprofessional and unsafe. Question 4. A client is being discharged with multiple medications. Which action best supports safe management of care? A. Provide verbal instructions only. B. Arrange medication reconciliation. C. Tell client to read labels at home. D. Ask family to search internet. Answer. B. Arrange medication reconciliation. Rationale. Medication reconciliation prevents errors and duplication. Verbal-only teaching and informal advice do not ensure safety. Question 5. Select all that apply. Which actions are appropriate when delegating to an LPN? A. Reinforce teaching after RN instruction. B. Perform initial admission assessment. C. Administer routine oral medications. D. Develop the nursing care plan. Answer. A. Reinforce teaching after RN instruction. C. Administer routine oral medications. Rationale. Delegation must follow the 5 rights of delegation: right task, circumstance, person, direction, and supervision. UAP may collect objective data, such as vital signs for stable clients, because this does not require interpretation. LPNs may reinforce teaching that has already been completed by the RN, but may not perform initial education. Initial assessment and documentation of client education require RN-level clinical judgment. Therefore, options C and D were incorrect. Question 6. The nurse must assign care for 4 clients. Which assignment is most appropriate for a float nurse from the obstetric unit? A. Client receiving blood transfusion. B. Stable client awaiting discharge. C. Client with chest tube suction. D. Client on multiple IV drips. Answer. B. Stable client awaiting discharge. Rationale. Assignments must match competency. The stable discharge client requires least specialized skills compared with complex medical treatments. Question 7. True or false? The RN retains accountability for outcomes of delegated tasks. A. True. B. False. Answer. A. True. Rationale. The RN maintains accountability for delegation and must ensure the task, person, and supervision are appropriate according to standards. Question 8. The nurse is prioritizing phone calls. Which should be returned first? A. Pharmacy asking for wait. B. Family requesting parking info. C. Lab reporting critical potassium 6.2. D. Dietary asking about menu. Answer. C. Lab reporting critical potassium 6.2. Rationale. Critical lab values indicate immediate risk for dysrhythmias and require rapid intervention. Other calls are non-urgent. Question 9. Yes or no? Should the nurse obtain informed consent for surgery when the client appears confused? A. Yes. B. No. Answer. B. No. Rationale. A confused client lacks decision-making capacity. Consent must be obtained from the legal representative to meet ethical and legal standards. Question 10. Which action by the charge nurse best demonstrates effective management of care? A. Completing all tasks personally. B. Delegating based on competency. C. Assigning randomly by room. D. Avoiding supervision of staff. Answer. B. Delegating based on competency. Rationale. Safe management requires matching client needs with staff skills and providing supervision. Random or avoidant approaches increase risk. Question 11. The nurse is caring for a client who wishes to leave the hospital against medical advice. What is the nurse's best action? A. Prevent the client from leaving. B. Notify the provider and explain risks. C. Call security to restrain the client. D. Remove the client's belongings. Answer. B. Notify the provider and explain risks. Rationale. Clients have the right to leave AMA. The nurse must ensure the client is informed of risks and notify the provider. Restraint or coercion violates client rights. Question 12. Which client can be safely assigned to a newly licensed RN? A. Client receiving titrated vasopressor. B. Client 1 hour post-cardiac catheterization. C. Client stable with pneumonia on oral antibiotics. D. Client with active GI bleeding. Answer. C. Client stable with pneumonia on oral antibiotics. Rationale. Stable clients with predictable outcomes are appropriate for a new RN. The other clients require advanced assessment and experience. Question 13. Select all that apply. Which actions support effective interdisciplinary collaboration? A. Sharing relevant client updates during rounds. B. Using SBER for communication. C. Making independent changes to medical orders. D. Clarifying unclear prescriptions with provider. Answer. A. Sharing relevant client updates during rounds. B. Using SBER for communication. D. Clarifying unclear prescriptions with provider. Rationale. Effective collaboration depends on accurate communication and mutual accountability. Sharing updates and using SBER promotes structured, clear exchange of information. Clarifying prescriptions prevents errors and supports client safety. Making independent changes to medical orders, option C, exceeds nursing scope and violates legal standards. Question 14. A family requests to view the client's medical record. What is the appropriate response? A. Provide record immediately. B. Verify client consent first. C. Refuse under all circumstances. D. Ask the unit secretary to print it. Answer. B. Verify client consent first. Rationale. Health information is protected. Release requires client authorization unless the family is legally designated. Question 15. Which situation requires completion of an incident report? A. Client falls without injury. B. Routine medication administration. C. Planned dressing change. D. Expected postoperative pain. Answer. A. Client falls without injury. Rationale. Any unusual event, even without harm, requires reporting for risk management and quality improvement. Question 16. True or false? The RN may delegate client education about a new diagnosis to the UAP? A. True. B. False. Answer. B. False. Rationale. Teaching about a new diagnosis requires professional nursing judgment and cannot be delegated to UAP. Question 17. The nurse is prioritizing care. Which task should be completed first? A. Documenting routine care. B. Administering scheduled antibiotics due now. C. Returning a family phone call. D. Restocking supplies. Answer. B. Administering scheduled antibiotics due now. Rationale. Timely medication administration directly affects client outcomes and takes priority over clerical tasks. Question 18. A nurse suspects another staff member is diverting narcotics. What is the priority action? A. Discuss with coworkers first. B. Report through proper channels. C. Ignore unless proof exists. D. Confront the staff member. Answer. B. Report through proper channels. Rationale. Suspected diversion threatens safety and must be reported per policy. Confrontation or delay may endanger clients. Question 19. Yes or no? Can an LPN independently create the initial nursing care plan for a newly admitted client? A. Yes. B. No. Answer: B. No. Rationale: development of the initial care plan requires RN assessment and clinical judgment. LPNs may contribute but not initiate it. Question 20. Which action best demonstrates advocacy in management of care? A. Following orders despite concerns. B. Questioning an unsafe prescription. C. Avoiding conflict with provider. D. Discharging client quickly to free bed. Answer: B. Questioning an unsafe prescription. Rationale: advocacy requires speaking up to prevent harm. Blindly following orders or avoiding conflict compromises client safety. Question 21. The nurse is preparing assignments for the shift. Which client should be assigned to the experienced RN rather than the LPN? A. Client requiring routine insulin injection. B. Client needing initial admission assessment. C. Client awaiting transportation to X-ray. D. Client stable after cast application. Answer: B. Client needing initial admission assessment. Rationale: initial assessments require comprehensive RN judgment. The other tasks are within LPN or assistive personnel scope for stable clients. Question 22. Which action by the nurse best supports cost-effective management of care? A. Opening extra supplies for convenience. B. Using evidence-based supplies appropriately. C. Replacing equipment before expiration. D. Ordering duplicate tests for reassurance. Answer: B. Using evidence-based supplies appropriately. Rationale: cost-effective care involves appropriate use of resources based on evidence. Wasteful practices increase healthcare costs without benefit. Question 23. Select all that apply. Which situations require the nurse to complete an incident report? A. Medication given 2 hours late. B. Visitor slips on wet floor. C. Client develops expected fever after vaccine. D. IV pump malfunction with no harm. Answer: A. Medication given 2 hours late. B. Visitor slips on wet floor. D. IV pump malfunction with no harm. Rationale: incident reports document any unexpected event or variance from standard care, even when no injury occurs. Late medication, visitor injury, and equipment malfunction all represent risk management concerns. An expected fever after vaccination, option C, is a normal physiological response and not an incident. Question 24. A provider writes an unclear medication order. What is the nurse's priority action? A. Administer based on judgment. B. Ask another nurse what it means. C. Clarify the order with provider. D. Hold the medication indefinitely. Answer: C. Clarify the order with provider. Rationale: the nurse must obtain clarification to ensure safety. Guessing or indefinite delay may harm the client. Question 25. Which client should the charge nurse see first during rounds? A. Client with oxygen saturation 89% on room air. B. Client requesting shower assistance. C. Client waiting for discharge papers. D. Client asking to speak with social work. Answer: A. Client with oxygen saturation 89% on room air. Rationale: hypoxia threatens airway and breathing and takes priority over routine or psychosocial needs. Question 26. True or false? A nurse may share client information with a neighbor who is concerned about the client's condition? A. True. B. False. Answer: B. False. Rationale: HIPAA protects client privacy. Information cannot be shared without client authorization, regardless of the neighbor's concern. Question 27. The nurse must float to another unit. What is the most appropriate action? A. Refuse because it is unfamiliar. B. Accept only tasks within competency. C. Perform all assignments given. D. Request immediate overtime pay. Answer: B. Accept only tasks within competency. Rationale: nurses must practice within scope and competence when floating and communicate limitations to maintain safety. Question 28. Yes or no? Should the nurse document an incident report in the client's medical record? A. Yes. B. No. Answer: B. No. Rationale: incident reports are confidential risk management documents and are not part of the medical record. Only objective facts of the event are charted. Question 29. Which action demonstrates appropriate time management? A. Completing easiest tasks first. B. Prioritizing by client acuity. C. Delaying complex procedures. D. Multitasking without planning. Answer. B. Prioritizing by client acuity. Rationale. Effective management organizes care based on urgency and client condition rather than convenience. Question 30. Select all that apply. Which behaviors reflect professional boundary violations? A. Accepting expensive gifts from client. B. Sharing personal phone number. C. Providing culturally sensitive care. D. Visiting client socially after discharge. Answer. A. Accepting expensive gifts from client. B. Sharing personal phone number. D. Visiting client socially after discharge. Rationale. Professional boundaries protect the therapeutic nurse-client relationship. Expensive gifts, personal contact information, and social relationships create dual relationships and risk exploitation. Providing culturally sensitive care, option C, is appropriate and supports ethical practice. Question 31. A nurse disagrees with a provider's discharge order for an unstable client. What is the best action? A. Follow the order to avoid conflict. B. Express concerns using SBR to provider. C. Tell the client to refuse discharge. D. Document disagreement only. Answer. B. Express concerns using SBR to provider. Rationale. Advocacy requires professional communication to prevent harm. Encouraging refusal or silent documentation does not resolve the safety issue. Question 32. The charge nurse notices a staff member making repeated medication errors. Which action is most appropriate? A. Immediately terminate the nurse. B. Ignore until harm occurs. C. Report pattern and arrange remediation. D. Reassign the nurse without explanation. Answer. C. Report pattern and arrange remediation. Rationale. Leadership requires protecting clients while supporting staff improvement through formal processes, not punishment or avoidance. Question 33. Select all that apply. Which actions demonstrate ethical nursing leadership? A. Advocating for adequate staffing. B. Covering a colleague's error. C. Promoting a culture of safety. D. Respecting client autonomy. Answer. A. Advocating for adequate staffing. C. Promoting a culture of safety. D. Respecting client autonomy. Rationale. Ethical leaders prioritize beneficence, non-maleficence, and autonomy. Advocacy and safety culture protect clients and staff. Respecting autonomy honors client rights. Covering a colleague's error, option B, is unethical and endangers clients. Question 34. A client requests information about assisted suicide in a state where it is illegal. What is the nurse's best response? A. Provide instructions as requested. B. Explore feelings and offer palliative resources. C. Change the subject. D. Agree to help secretly. Answer. B. Explore feelings and offer palliative resources. Rationale. The nurse should provide emotional support and legal alternatives. Assisting would violate law and ethics. Question 35. The nurse witnesses a physician speaking disrespectfully to a client. What should the nurse do first? A. Report to administration only. B. Support the client and address behavior. C. Ignore to maintain hierarchy. D. Argue with the physician. Answer. B. Support the client and address behavior. Rationale. Leadership involves protecting dignity and addressing unprofessional conduct using respectful communication. Question 36. True or false? It is acceptable for a nurse leader to alter staffing ratios to reduce overtime costs even if acuity is high? A. True. B. False. Answer. B. False. Rationale. Staffing must be based on client acuity and safety, not financial convenience. Unsafe ratios are unethical. Question 37. A terminally ill client requests that the nurse keep the diagnosis secret from family. What is the appropriate action? A. Inform family immediately. B. Respect confidentiality. C. Ask provider to decide. D. Encourage family meeting. Answer. B. Respect confidentiality. Rationale. The competent client controls disclosure of personal health information. Autonomy must be honored. Question 38. Yes or no? Should a nurse accept a $200 gift from a grateful family after discharge? A. Yes. B. No. Answer: B. No. Rationale: accepting expensive gifts creates boundary violations and potential conflicts of interest. Polite refusal is required. Question 39. Which action best reflects transformational leadership on a unit? A. Punishing staff for mistakes. B. Encouraging shared decision-making. C. Avoiding change to keep peace. D. Making all decisions alone. Answer: B. Encouraging shared decision-making. Rationale: transformational leaders inspire collaboration and growth rather than control or avoidance. Question 40. Select all that apply. Which situations require the nurse to invoke the chain of command? A. Provider refuses to address critical lab. B. Disagreement about lunch breaks. C. Order appears unsafe for the client. D. Persistent harassment on the unit. Answer: A. Provider refuses to address critical lab. C. Order appears unsafe for the client. D. Persistent harassment on the unit. Rationale: the chain of command is used when client safety, legal standards, or professional conduct are threatened. Ignored critical labs and unsafe orders pose immediate harm. Harassment affects workplace safety. Disagreements about lunch breaks, option B, are administrative, not safety issues. Question 41. The RN must delegate morning tasks. Which task is safest to assign to the UAP? A. Assess pain after medication. B. Obtain daily weight on heart failure client. C. Teach use of incentive spirometer. D. Evaluate surgical wound drainage. Answer: B. Obtain daily weight on heart failure client. Rationale: daily weights are data collection appropriate for UAP. Options A and D require evaluation, and C requires teaching. Both RN responsibilities, creating the classic two right answers trap. Question 42. A provider gives a verbal order that seems unsafe. What should the nurse do first? A. Carry out the order immediately. B. Clarify the order with the provider. C. Ask another nurse to decide. D. Document and wait for rounds. Answer: B. Clarify the order with the provider. Rationale: client safety requires immediate clarification. Implementing or delaying could cause harm, and decision-making cannot be transferred to another nurse. Question 43. Select all that apply. Which tasks may the RN delegate to the LPN? A. Administer routine oral medications. B. Perform initial care plan creation. C. Reinforce teaching already provided. D. Start blood transfusion. Answer: A. Administer routine oral medications. C. Reinforce teaching already provided. Rationale: LPN scope includes routine, predictable care and reinforcement of RN teaching. Initial care planning and starting blood transfusions require comprehensive assessment and RN responsibility. Therefore, options B and D are incorrect. Question 44. The nurse manager is asked to reduce staffing despite high acuity. What is the most ethical action? A. Comply to meet budget goals. B. Advocate using acuity data. C. Ask staff to work faster. D. Lower admission standards. Answer: B. Advocate using acuity data. Rationale: ethical leadership prioritizes safety and uses objective evidence to challenge unsafe directives. Question 45. Two tasks appear appropriate for UAP. Ambulate a stable client or feed a client with new dysphagia. Which should be delegated? A. Ambulate the stable client. B. Feed the client with dysphagia. C. Delegate both tasks. D. Delegate neither task. Answer: A. Ambulate the stable client. Rationale: feeding a client with new dysphagia requires assessment for aspiration risk, RN responsibility. Ambulation of a stable client is safe for UAP. Question 46. True or false? It is acceptable to document that a medication was given if another nurse states she administered it? A. True. B. False. Answer: B. False. Rationale: nurses may document only care they personally perform. Charting otherwise is falsification and unethical. Question 47. A family asks the nurse to hide a cancer diagnosis from the competent client. What is the best response? A. Agree to protect family wishes. B. Encourage honest disclosure to client. C. Avoid discussing the topic. D. Ask another nurse to handle it. Answer: B. Encourage honest disclosure to client. Rationale: the client has the right to know their diagnosis. The nurse must support autonomy while being culturally sensitive. Question 48. Yes or no? Can the RN delegate tracheostomy suctioning of a newly placed trach to UAP? A. Yes. B. No. Answer: B. No. Rationale: new tracheostomy care requires assessment and sterile technique by RN or qualified LPN, not UAP. Question 49. The RN has two possible delegates: UAP with 10 years experience or new LPN, who should receive a complex dressing change on a fresh postoperative wound. A. Experienced UAP. B. New LPN. C. Either is acceptable. D. Neither. RN must perform. Answer: D. Neither. RN must perform. Rationale: fresh postoperative wound assessment requires RN judgment despite experience level. Classic delegation trap focusing on task, not person. Question 50. Select all that apply. Which actions show ethical delegation by the RN? A. Considering client stability. B. Delegating to reduce workload only. C. Providing clear instructions. D. Verifying competency of delegate. Answer: A. Considering client stability. C. Providing clear instructions. D. Verifying competency of delegate. Rationale: ethical delegation centers on client safety and staff capability. The RN must evaluate client condition, communicate expectations, and confirm competence. Delegating only to reduce workload, option B, ignores safety principles and violates delegation standards. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.